So good morning to all. So another topic in pharmacology, that is the immunosuppressant. What is immunosuppressant? The drug which decrease immune rejection system. Okay? The drug which decrease immune rejection system. The drugs which decrease immune rejection system. What is immunosuppressant? Immunosuppressant means the drug which decrease the immune rejection system. Immune rejection system means if our immune power rejects the body, so that the drug suppress the rejection system. So that is the immunosuppression. So the immunosuppressant mainly used in graft rejection. Used in graft rejection. So the immunosuppressant mainly used in the graft rejection. Mainly used graft rejection. If the question asks the in graft rejection, the drug of choice for graft rejection. The drug of choice of graft rejection is the immunosuppressant. That is the one-liner question. The one-liner question. The drug of choice, the graft rejection is the immunosuppression. Then another immunosuppression is the steroid like prednisolone, dexamethasone, prednisolone, dexamethasone. The steroids. That is first one is the prednisolone. Second one is the dexamethasone. Yeah. The another immunosuppressant is the steroid. The steroid is the prednisolone is a steroid and the dexamethasone is a steroid. Steroid. The steroid is used in the graft rejection also. You use the steroid, and any adverse event we also use the steroid. Use graft rejection, any adverse effect. The steroid also used in graft rejection, and any adverse effect we also use the steroid. Then we move to the another immunosuppressant, that is the calcineurin inhibitors. That is the calcineurin inhibitors. The calcineurin inhibitors. The calcineurin inhibitors is also a immunosuppressant. It is the first line drug of graft rejection. The first line drug of choice or graft rejection. Graft rejection. Okay? The calcinarium inhibitor is the first line drug of choice, the graft rejection. So if the question asks what is the first line drug of choice of the graft rejection, we put answer the calcinarium inhibitors. Calcinarium inhibitors. So, what is the side effect or the adverse effect? Okay? What is the side effect? The calcinarium inhibitor are nephrotoxic, toxic. Second one is the hepatotoxic. Then the calcinarium inhibitor are nephrotoxic. Second one is the hepatotoxic. Then third one is the hyperkalemic. Hyperkalemic means increase potassium. Clear? The hyperkalemic. So, adverse effect of the calcinarium inhibitor, the hyperkalemic means the increase potassium level. Then hyperglycemic means increase the glucose level. Then fifth one is the STN. Yeah? The side effect or adverse effect is the of calcinarium inhibitor. Number 5 is the STN. So that the overall the side effect of calcinarium inhibitor is the nephrotoxic, hepatotoxic, hyperkalemic means the increased potassium, then hyperglycemic increased blood sugar level, and STN. Then the cyclosporine. Yeah? Cyclosporine side effect. Yeah, cyclosporine. It is also a immunosuppressant. The cyclosporine is a immunosuppressant. Yeah? Cyclosporine is a immunosuppressant that also used in the second line drug of choice in the graft rejection. So that the cyclosporine adverse effect or the side effect is hyperplasia of gums. The cyclosporine is a immunosuppressant. The side effect, SC means the side effect. The side effect is the hyperplasia of gums. That is the one-liner question in entrance examination. So many times the question already asked in the exam. Means the hyperplasia is due to, the question asks the hyperplasia of gums. Hyperplasia of gums is due to the cyclosporine. Then another immunosuppressant, that is the basilicizumab. bacillic zima. Clear? The bacillic zima is a immunosuppression. Clear? The bacillic zima is a immunosuppression that used in the acute graft rejection. Acute graft rejection. Clear? The bacillic zima. The bacillic zima is a immunosuppression. Clear? It is used in the acute graft rejection. It is acute graft rejection. So the question asked in the acute graft rejection, the drug of choice is the bacillizumab. The acute graft rejection, the drug of choice, the bacillizumab. Then another immunosuppressant is the azathioprine. The azathioprine. Yeah, the azathioprine is a immunosuppressant. It is also used in graft rejection. The azathioprine is a immunosuppressant. The azathioprine is a immunosuppressant. It is also used in graft rejection. Which drug is the azathioprine? Azathioprine is a immunosuppressant. So which point I am saying here, please remember this and write down this. So it is clear cut exam questions. Previously it also asked in so many times. Then next immunosuppressant is the thalidomide. Thalidomide. The thalidomide is less preferable. Thalidomide is less preferred. Yeah? Thalidomide is less preferred due to teratogenicity. Teratogenicity. Yeah? The thalidomide is less preferred. Why? Because it causes the congenital malformation of the fetus. Yeah? The thalidomide is a immunosuppressant. It is less preferred. We prefer it is less because the teratogenicity. Teratogenicity means the congenital malformation of fetus. So that thalidomide causes the phocomelia. The thalidomide causes phocomelia. The thalidomide causes the phocomelia. The question asks, the thalidomide is less preferred drug due to its teratogenicity. The thalidomide is a less preferred immunosuppressant is due to the teratogenicity. And second question, the thalidomide causes the phocomelia. The thalidomide causes phocomelia. This is the question. This is also a question. That is question number 1 and question number 2. So this is all about the immunosuppressant. So this topic is very much important, and many more questions previously asked from this topic. So read carefully, remember carefully, so that you will achieve your goal. So thank you to all.